When we are caring for the critically ill or injured patient, there is going to be potentially, for that particular patient, this feeling of anxiety, pain and fear, anger and hostility, depression, dependency, guilt. And then also, most importantly, mental health problems, or I should say not most importantly, but could occur, which is mental health problems. These are concerns that kind of come up when we're kind of dealing with this, and so we kind of want to make note of that. And then obviously receiving unrelated bad news is another thing that we want to kind of keep note of. We want to make sure that we always careful to, avoid sad and grim comments. When we're kind of talking about that loved one, we want to be careful on, describing certain things about their loved ones that might be sort of uncomfortable for the other. We always want to be respectful. We want to orient the patient the best possible, be honest, which I've already kind of discussed as well. We always want to acknowledge the seriousness of the condition. And a perfect example of this is I had a little 7-year-old that had drowned in a pool this summer. And when I was interacting with the family member was kind of in denial. She was kind of like, well, the paramedics are here. They're going to save her and she's going to be fine. She's out of the pool. She looks like she's breathing. She's kind of moving her head. Well, what mom didn't realize, or maybe she just kind of hadn't come to the realization, was that her little girl was definitely not acting appropriate, was extremely lethargic, was not appropriate. She looked sick. She looked like she was in severe distress. And so one of the things that I did with mom is I brought her aside and looked her in the face and I says, ma'am, I want to let you know your daughter is very, very sick right now. And we are doing everything we can right now, but she is definitely very sick. And how she's acting right now is not okay. And we're very concerned about her. And so we need to quickly put her on the stretcher and we need to go to the hospital very quickly. Are you going to come with me? And the minute that I acknowledged that, and the minute that I told her that, and I was very honest with her, I was polite, I was professional, she just started breaking down and crying when she realized, she had gotten outside of that denial piece and had realized how sick. And one of the things that I told her was that I want you to be aware that we are going to do everything we can to make sure she's okay. And then last but not least, I, asked her, I says, is there anybody else that we can call while we're headed to the hospital, or is there anybody that you can call that can maybe come and be here with you during this particular situation? And, despite the fact that this mother, kind of lost it and she started crying and, she was kind of hysterical, which is a normal reaction that I would have expected, I was still very honest with her, but then I also provided some extra things to assist her. When we talk about factors that can affect patients' reactions, we need to take in consideration socioeconomic backgrounds. This can definitely affect a patient or a family member and how they react to medicine and different ailments that we interact. Definitely a fear of medical personnel, maybe alcohol and substance abuse, chronic diseases, mental disorders, medication reactions. Age is a factor. If we have somebody young or somebody very old, that we're going to potentially see some differences. Nutritional status would also be a factor. And last but not least, guilt feelings. When we talk about this whole idea of socioeconomic background, this may be a patient or a family member who doesn't have a lot of money or comes from a poor area. Their view of medicine may be a little different than your view of medicine. Maybe this is an elderly person who fears medical professionals because of the fact that every time they show up, they take me to the hospital and I stay in the hospital for several days. Maybe, you're coming here to accuse me of my substance abuse problem or my alcohol addiction. Maybe I have chronic diseases. There's no way I'm going to get over this. This is just what I have. And these are all going to be factors that affect that. Mental disorders, definitely. And then also guilt feelings about the situation.